Yes, I definitely recommend this. More importantly, I myself took the vaccine. I was one of the first people to take the vaccine. And yes, indeed, I am a good mask wearer, but I have not contracted COVID-19. And I have been in every prison in Washington State investigating outbreaks. I've been in every migrant camp with no ventilation, investigating outbreaks, wearing a mask and being vaccinated. And I have yet to become infected, and no one on my team has been infected. So yes, I feel strongly enough about getting it myself. And let's be honest, I don't just do it for me, I do it so I protect my patients and my family. And I recommended it for my family. I have 3 kids and they all got vaccinated. Right now, the biggest risk factor for being infected, of course, is large gatherings. So once you are vaccinated, you'll be allowed to go to some of these large gatherings, even without a mask, if they're outdoors, etc. But probably the most significant issue will be school. And if you are exposed to someone at school, but you're vaccinated with a mask, you won't be quarantined. That is probably the most significant time constraint that releases you if you're vaccinated, is that you're not considered a full exposure if you're fully vaccinated. We are now in a very different place in this pandemic. The Delta variant is much more infectious, and we are seeing a very large rise in the number of cases. Actually, the highest age group for cases right now is those 11 to 14. This is not the only concern. It's not just about getting a case, it's about who are you exposing. And so if you're a kid in this age group, you could still expose your grandma, you could still expose your aunt or your cousin who has cancer, and the outcome for them is going to be a lot worse. We want to do everything we can to protect the family members around these kids, and one of the best ways to do that is to vaccinate kids. This vaccine has been tested more aggressively than most other vaccines we've ever had, and the efficacy of this vaccine is higher than vaccines that we're used to. I know everyone has this sense that, oh, this was a rush job on the vaccine, and that's just not true. 2 very important pieces of science were done before this vaccine was made available. One of those was safety. Is this vaccine safe? And all the studies have shown that it's very safe. Put this in contrast to COVID. COVID is not a safe infection. So all these things people worry about, like pericarditis from the vaccine, it's much worse with the disease. So the risk and the safety of this vaccine has been studied pretty well. Now we get a better sense when we move this out to millions of kids across the world, and we'll get a better sense of how safe and how rare some of these conditions can be from the vaccine. But as we stand right now, the FDA has approved this given the safety profile. The efficacy of this is the other arm that's done, and these were done together at the same time, looking at both safety and efficacy, carefully studied and shown that this vaccine is highly efficacious even for this younger age group. So the most common side effects are sore arm at the site where you got the injection. Some, or a significant portion, say 20 to 30%, can feel really tired afterwards. It's rare to have lots of fevers. It's essentially very self-limited and lasts about 24 hours and then it's gone. The younger you are, the less side effects we have seen, but it still remains to see how common these common side effects will be. I think what most parents worry about most are these other really dramatic things like pericarditis, which is inflammation of the heart muscle. And while that is true, it is incredibly rare. It is more common in males that are teens to young adults. But again, contrasting this to the actual pericarditis seen from COVID disease, it's minuscule compared. Nobody knows that for sure, for certain, but there is certainly no reason to believe, like any other vaccine, that there would be long-term effects. There's a lot of misinformation that goes into these. These are not genetic modifiers of your own DNA. They actually are only protein messages that tell your body to make antibodies, and it is not integrated into your DNA. So there really should not be any long-term effects. I would say, there's a lot of science misinformation. Talk to someone who is a knowledgeable science expert that you trust. Getting information off the internet is not the best way to be getting evidence. Talk to your nurse, talk to your doctor, talk to your trusted medical professional to ask them what their opinion on this vaccine is. I have no idea. I mean, if you would have asked me this, so I diagnosed the very first case of COVID in the United States. My team in Seattle was the team that did this. And if you would have asked me then, I would have said it would probably be about 6 months. And 6 months after that, I would have said, well, maybe a year. And now we're almost to 2 years with this. I'm starting to think we're going to have this virus like influenza seasonally every year, and we're going to have to learn how to control it.